How does anxiety differ from depression?
Well, in anxiety, rather than having feelings of sadness, emptiness, worthlessness, the feelings are predominantly those of excessive worry or fear.
Okay.
There are several types of anxiety disorder that maybe have different balances of those two feelings. In what we call generalized anxiety disorder, people experience chronic excessive worry. They cannot stop worrying.
They worry about everything.
They worry about everything. They feel tense. They cannot relax. They may have physical symptoms like muscle tension, grinding their teeth, nervous stomach.
Do you find that they worry about things that don't even occur, that never will occur? They just create things to worry about, but they don't realize that they're doing it? Very often the case. They can either worry about little things, things that their family members don't understand why they worry about them, and sometimes even they can tend to catastrophize things and always think about the worst possible outcome and even come up with some scenarios that aren't even very possible. Okay, so they can actually take a very small thing and make it huge.
Correct.
How common is anxiety, and are there types of anxiety conditions just like there are types of depression?
There are.
Okay.
Let me run through a few of the others. Panic disorder is quite different than a generalized anxiety. Instead of having chronic, persistent anxiety almost all the time, people with panic disorder have very dramatic panic attacks. All of a sudden, out of the blue, they may become very fearful, and they develop very prominent physical symptoms like chest pain, having their heart pounding, feeling short of breath, dizzy, lightheaded. Often they feel as though they're having a heart attack and need to go to an emergency room, and often they do, as a matter of fact.
Very frightening and very real.
Very frightening and real.
But is it very treatable?
Very treatable with professional care. There are medications that work wonders for this condition.
Okay.
A third type of anxiety disorder are what we call phobias, and these are fears of specific objects or situations. People that may have a very pronounced fear of flying in an airplane, crowds, even driving on an expressway. Again, very treatable, either with various specific types of counseling or medications. And
I think we've seen a lot of that in the last couple of years. It's become more obvious, and you hear about people who are afraid to leave their homes, afraid to get into a car either driving or as a passenger. They simply won't do it, and they start to pull back, and eventually they just don't go out anymore.
Correct.
That too is very treatable.
It is very treatable, and that specific form of the phobia we refer to as agoraphobia. Okay. There's one other anxiety condition that I'd just like to touch on because it's fairly common.
Lots of time.
What we call social anxiety disorder or social phobia is a condition in which people are just very, very anxious in social situations. When they're in a social situation, they tend to be preoccupied with a fear that they will be embarrassed or humiliated in that social situation, and they tend to avoid being out for that particular reason. Okay,
now would that also include, when you say a social situation, when you say that to me, I think of going to a restaurant, speaking, to a group of people, being in some type of a convention center. There's a lot of people there. But what about family gatherings? Do they also feel that way if they're with their family of 10 people in a room?
Yes. Even family. Usually people with social phobia can be pretty comfortable with one or two good friends or close family members, but as the group gets larger, they tend to get more and more anxious. Okay. And they can even have trouble with routine tasks like writing a check out in front of a cashier. They can be shaking so much that it's very difficult to write because that for them is also a social situation.
Amazing. So that would affect them even just day to day, like you say, writing a check out, going to the grocery store.
Correct.